Folks, imagine you're walking through your local mall in Fredericton, enjoying a summer day, when you hear about a mysterious illness spreading in another part of Canada. It's not contagious, but it's seriously linked to something as ordinary as the air conditioning above your head. That's exactly what's happening in London, Ontario, right now, with an outbreak of Legionnaires disease. Welcome to the Herald podcast, hosted by San Juan, where we dive deep into health stories that matter to Canadians, especially here in New Brunswick. Today, we're tackling a pressing public health issue, a Legionnaires disease outbreak that has sickened over 40 people in London, Ontario, and claimed one life as of July 2025. This severe form of pneumonia, caused by Legionella bacteria, lurking in water systems like HVAC units, has sparked an urgent investigation by the Middlesex London Health Unit, MLHU, and Public Health Ontario, PHO. While the outbreak is localized, it raises questions about the safety of the buildings we work and live in across Canada. Why does this matter to you in New Brunswick? Well, Legionnaires disease isn't just an Ontario problem, can strike anywhere water systems aren't properly maintained. From Moncton's office towers to St. John's community centers, the bacteria thrive in warm, stagnant water, and with summer in full swing, the risk is higher. This story isn't just about one city, it's about how we protect our communities from hidden health threats. On today's episode, we'll explore the outbreak's origins, how Legionella spreads through systems like cooling towers, and what public health officials are doing to stop it. We'll hear from stakeholders, health officials, building managers, and vulnerable residents, and connect this to New Brunswick, where aging infrastructure and rural healthcare access could amplify risks. We'll also compare Canada's response to global standards and look at what this outbreak means for the future. So, grab a coffee and let's dive into this critical health story. What do you think? Have you ever worried about the safety of the water systems in your workplace? Share your thoughts on X as we go. To understand the Legionnaires disease outbreak in London, Ontario, we need to step back and look at the history of this bacterial threat and Health Canada's role in addressing it. Legionnaires disease, caused primarily by pneumophila, was first identified in 1976 after a deadly outbreak at an American Legion convention in Philadelphia, where 29 people died from a mysterious pneumonia. The bacteria, found naturally in freshwater environments, thrive in human-made water systems like cooling towers, hot tubs, and plumbing when conditions warm temperatures -50 degrees Celsius, stagnant water, or biofilms allow rapid growth. Unlike most infectious diseases, Legionnaires doesn't spread person to person. It's contracted by inhaling aerosolized water droplets containing the bacteria. In Canada, Legionnaires disease is relatively rare, with fewer than 100 reported cases annually, though underdiagnosis is likely since many pneumonia cases aren't tested for Legionella. Pontiac fever, a milder flu-like illness caused by the same bacteria, is even less reported. Outbreaks often occur in summer and fall when cooling systems are in heavy use, as seen in a 2012 Quebec City outbreak that killed 14 people and was traced to a cooling tower. This event prompted Quebec to introduce strict regulations, including mandatory cooling tower registries and maintenance plans. Health Canada and its agency, the Public Health Agency of Canada, PHAC, play a central role in Legionella surveillance and response. PHAC maintains national case definitions and tracks notifiable diseases, collaborating with provincial health units like PHO to investigate outbreaks. Their Legionella guidelines emphasize preventive maintenance of water systems and risk communication. In Ontario, PHO provides laboratory support and epidemiological data, reporting a rise in Legionnosis from 1.4 cases per 100,000 in 2012 to 2.6 in 2021, with 363 cases in 2024. The elderly, smokers, and immunocompromised individuals are most at risk, with men affected more than women. Previous outbreaks in Canada offer lessons. In 2022, Simcoe, Muskoka, Ontario, saw 35 cases linked to cooling towers, resulting in 1 death and 29 hospitalizations. Despite extensive testing, pinpointing the exact source was challenging, a recurring issue in Legionella investigations due to the bacteria's ubiquity and the complexity of water systems. In 2024, London faced a similar outbreak, with 30 cases and 2 deaths, ending naturally as cooling systems were shut off in late summer. These incidents highlight the need for robust maintenance protocols and rapid public health responses. In New Brunswick, Legionnaires cases are less frequent, but the province's aging infrastructure, think of older hospitals in Fredericton or community centers in Bathurst, poses risks. Rural areas often rely on outdated HVAC systems, and limited healthcare access can delay diagnosis. Health Canada's guidelines, adopted provincially, stress regular testing and maintenance, but enforcement varies. The 2012 Quebec outbreak led to national discussions about cooling tower registries. Yet Ontario and New Brunswick lack universal mandates, relying instead on voluntary compliance and local health unit oversight. Globally, Legionnaires' disease has spurred action. The U.S. Centers for Disease Control and Prevention (CDC) promotes water management plans, while Australia and Europe enforce strict cooling tower regulations. Canada's approach, while proactive in surveillance, lags in mandatory infrastructure standards, a gap exposed by recurring outbreaks. This history sets the stage for the 2025 London outbreak, where public health officials are racing to identify the source and prevent further spread. Let's break down the 2025 Legionnaires' disease outbreak in London, Ontario, and unpack its mechanics, implications, and the public health response. As of July 2025, the MLHU reported 43 confirmed cases within a 6-kilometer radius in southeast London, with 1 fatality. Most cases emerged in the past week, a sharp spike from the few monthly cases typically seen. Dr. Joanne Kieran, MLHU's Associate Medical Officer, noted a wide age range among those affected, with individuals over 50 at higher risk. The outbreak's localization suggests a common source, likely a cooling tower or HVAC system, but the exact origin remains elusive. Legionella bacteria thrive in warm, stagnant water, Y-50 degrees Celsius with biofilms or sediment. Conditions common in cooling towers, hot water tanks, and plumbing. When these systems aerosolize water, think of the mist from a cooling tower or shower head. The bacteria become airborne and can be inhaled. Cooling towers, used in large buildings to dissipate heat, are notorious culprits. They release water droplets that can travel kilometers, potentially entering nearby ventilation systems or spreading through open windows. In London's 2024 outbreak, 3 of 12 tested cooling towers showed Legionella, but no exact match was found with human cases, illustrating the challenge of source identification. The bacteria's environmental ubiquity complicates matters. Found in lakes, rivers, and soil, Legionella only becomes a health risk in high concentrations, typically in poorly maintained systems. For example, a cooling tower with stagnant water or inadequate disinfection can become a breeding ground. The MLHU is testing environmental samples, using techniques like quantitative polymerase chain reaction (qPCR) and culture-based methods, which can take up to 14 days. This delay hinders rapid intervention, as seen in the 2022 Simcoe outbreak. The MLHU, with PHO support, declared the outbreak after cases surged past the seasonal norm. Their response involves epidemiological investigation, mapping cases to identify common locations, for example, workplaces, public buildings within the 6-kilometer radius, environmental sampling, testing cooling towers, HVAC systems, and other water sources for Legionella, comparing isolates to those from patients. Risk communication, advising residents to seek medical attention for symptoms like fever, cough, or shortness of breath, while reassuring the public that person-to-person transmission is not a concern. Preventive guidance, urging property managers to maintain and sanitize cooling systems per manufacturer instructions. Dr. Isaac Bogach, AN, infectious disease specialist, emphasized that outbreaks often stem from a single contaminated source, like an HVAC system in a mall or office. The MLHU's inability to pinpoint the 2024 outbreak source suggests similar challenges now, as cooling towers are numerous and testing is resource intensive. The health unit predicts the outbreak may subside by late summer, as cooling systems are turned off, but this assumes no new sources emerge. The outbreak has hospitalized most of the 43 cases, with 1 death underscoring Legionnaire's severity. The 2024 outbreak's 76.6% hospitalization rate and 5% mortality rate align with this trend. Those most affected, older adults, smokers, or immunocompromised individuals, face prolonged recovery, with antibiotics like azithromycin used for treatment. The public health effort has strained local resources, requiring coordination with PHO's laboratories and provincial experts. Businesses in southeast London face scrutiny over their water systems, potentially disrupting operations if systems are shut down for testing or remediation. Identifying the source is a logistical nightmare. Cooling towers are widespread, and not all are registered or regularly tested. Ontario lacks a mandatory cooling tower registry, unlike Quebec, which implemented one post-2012. Testing involves collecting water samples, culturing bacteria, and comparing genetic profiles to patient isolates, a process that's both time-consuming and costly. False negatives are common if sampling misses the contaminated area. Moreover, Legionella's ability to spread kilometers via aerosols means cases may not be tied to a single building. Complicating the investigation, public perception is another hurdle. While MLHU assures a low public risk, the lack of a confirmed source fuels anxiety. Residents may fear visiting public spaces, and businesses may face reputational damage if linked to the outbreak. The MLH used transparent communication, acknowledging the unknown source while urging to balance honesty with reassurance. This outbreak highlights gaps in Canada's infrastructure maintenance. Many buildings, especially older ones, have outdated HVAC systems prone to Legionella growth. In New Brunswick, similar risks exist in facilities like Moncton's hospitals or Miramichi's community centers, where budget constraints often delay upgrades. Health Canada's guidelines recommend regular maintenance, but compliance is inconsistent without enforceable regulations. The outbreak also underscores the importance of rapid diagnostics, as improved testing has increased case detection but not necessarily source identification. The London outbreak has drawn responses from multiple stakeholders, each with unique concerns and roles. Let's explore their perspectives, ensuring a balanced view while highlighting New Brunswick connections. The MLHU, led by Dr. Joanne Kieran, is at the forefront, coordinating the investigation and public messaging. Kieran emphasizes that Legionnaires is not contagious and urges residents with symptoms to seek care. The health unit's priority is source identification, but the lack of a confirmed origin mirrors the 2024 outbreak's challenges. PHO supports with laboratory testing and epidemiological analysis, noting that 2024's 363 cases align with historical trends, though Middlesex London's 7.7 cases per 100,000 far exceeds the provincial average. Health Canada, through PHAC, provides national surveillance and guidelines, stressing preventive maintenance. Officials advocate for calm, noting the low public risk, but face pressure to deliver answers quickly. Doctors and hospitals in London are treating severe cases, with most patients requiring hospitalization. Dr. Isaac Bogach from Toronto General Hospital highlights the importance of tracing common exposure points, like HVAC systems in public buildings. In New Brunswick, physicians like those at the Dr. Everett Chalmers Hospital in Fredericton note that rural patients may face delays in diagnosis due to limited access to specialized testing. Early antibiotic treatment is critical, but misdiagnosis, as regular pneumonia is a risk, especially in areas with fewer resources. Property managers in southeast London are under scrutiny, as cooling towers are prime suspects. The 2024 outbreak showed Legionella in 3 towers, and similar findings are expected now. Managers are urged to follow maintenance protocols, like keeping water heaters at 60 degrees Celsius and disinfecting systems regularly. In New Brunswick, businesses in St. John or Moncton face similar pressures, especially in older buildings. Non-compliance risks, legal and reputational consequences, but small businesses often lack the funds for costly upgrades. The Canadian Water Compliance Group emphasizes regular testing to avoid outbreaks, offering services to ensure compliance. Patients and families, particularly those of the deceased, seek clarity on the outbreak's source. Older adults and immunocompromised individuals, like those in London's retirement homes, feel vulnerable. In New Brunswick, advocacy groups like the New Brunswick Lung Association stress education on Legionella risks, especially for smokers or those with chronic lung conditions. Indigenous communities, such as those in Elsipogag First Nation, express concerns about aging infrastructure in community centers, fearing similar outbreaks. Some experts criticize Ontario's lack of a cooling tower registry, arguing it delays outbreak responses. Quebec's post-2012 regulations are cited as a model, with mandatory maintenance and reporting reducing risks. Critics also note that Health Canada's guidelines are robust but lack enforcement, leaving gaps in provincial implementation. In New Brunswick, experts like those at the University of New Brunswick's environmental health programs call for stronger provincial oversight of water systems. In New Brunswick, the London outbreak raises red flags about infrastructure vulnerabilities. Rural hospitals, like those in Miramichi or Campbellton, often rely on older HVAC systems, and budget constraints limit upgrades. For Acadian communities in Caraquet or Indigenous groups in Tobique First Nation, limited healthcare access could delay Legionnaires' diagnosis, increasing severity. The province's tourism sector, including hotels in Moncton, faces risks if cooling towers aren't maintained, potentially deterring visitors. New Brunswick's Department of Health follows Health Canada's guidelines, but local health units lack the resources for widespread testing. A hypothetical outbreak in Fredericton could strain the province's healthcare system, given its 76.6% hospitalization rate. Nationally, the outbreak underscores Canada's patchwork approach to Legionella prevention. Ontario's high case rate, 7.7 per 100,000 in Middlesex, London, contrasts with lower rates in the GTA, under 1.9. Quebec's regulations set a precedent, but other provinces, including New Brunswick, rely on voluntary compliance. Health Canada's surveillance through PHAC is robust, but without mandatory registries, outbreaks are harder to prevent. The 2012 Quebec City outbreak led to 14 deaths, prompting national discussions, yet progress on unified standards remains slow. Globally, the US CDC mandates water management plans for large buildings, with tools like the Prevent LD training program. Australia's cooling tower regulations require regular testing, and Europe's Legionella surveillance network provides genetic typing for rapid source identification. Canada's approach, while strong in surveillance, lacks the regulatory teeth of these systems. The London outbreak could push Health Canada to advocate for national standards, aligning with global best practices. Recurring outbreaks like London's, in 2024 and 2025, highlight the need for systemic change. Aging infrastructure across Canada, including New Brunswick, poses ongoing risks. Climate change, with warmer summers, may exacerbate Legionella growth, increasing outbreak frequency. Public trust could erode if sources remain unidentified, impacting businesses and tourism. In New Brunswick, rural communities could face disproportionate impacts due to healthcare access gaps. Proposed solutions: mandatory cooling tower registries. Ontario and New Brunswick should adopt Quebec-style registries to track and test cooling towers, ensuring compliance. Enhanced maintenance standards. Health Canada could mandate regular Legionella testing for HVAC systems, with subsidies for small businesses. Public education campaigns targeting higher-risk groups, for example, seniors, smokers, could reduce misdiagnosis and improve outcomes. Rapid diagnostics, investing in faster testing methods, like advanced qPCR, could speed up source identification. New Brunswick focus. The province could prioritize infrastructure upgrades in rural hospitals and community centers. With funding from Health Canada, these solutions balance prevention with feasibility, addressing both immediate and long-term risks while supporting vulnerable communities. The 2025 Legionnaires disease outbreak in London, Ontario, is a stark reminder of the hidden dangers in our water systems. With 43 cases and 1 death, the MLHU and PHO are working tirelessly to find the source. But the challenge underscores gaps in Canada's approach to Legionella prevention. For New Brunswickers, this is a wake-up call to ensure our buildings in Moncton's downtown or Bathurst's community centers are safe. Health Canada's guidelines are a start, but stronger regulations, like cooling tower registries, could prevent future outbreaks. Folks, let's talk: what steps can we take in New Brunswick to keep our communities safe? Share your thoughts on In related news, Health Canada issued a July 2025 advisory urging property managers to test water systems for Legionella ahead of peak summer months. The advisory emphasizes maintenance protocols and references resources like PHAC's Legionella guidelines. This aligns with the London outbreak response, reinforcing the need for proactive measures. Stay informed at www.canada.ca/health.